Okay, it's 5:30. We'll call this meeting of the Newark City Council Finance Committee to order. Members present are Mrs. Floyd, Mr. Marmee, Mr. Bubb, Mr. Costa, and myself. I want to welcome you all to the meeting tonight. We do have some items on our agenda. I just want to remind folks that after I read the title of the agenda, we'll ask someone who's a sponsor from the administration to speak on the piece of legislation, and then we'll open it up for the audience and for committee members to ask their questions. But please use the podium and direct your questions to the chair, please. Our first item on our agenda is to consider resolution number 1417, authorizing and directing the mayor of the city of Newark to apply for funding from the United States Department of Justice, Bureau of Justice Assistance under the Bulletproof Vest Partnership Grant Program. And I got that all out there, Miss Gilks.
This is our annual application, and this is a grant where we front 100% of the cost of a vest, and we are reimbursed 50%. This covers the needs of the police department, adult probation, and the arson investigators for the Division of Fire.
Thank you very much. I'll make a motion. Motion by Mrs. Floyd, second by Mr. Bubb. Any questions from the committee? Questions from the audience? Easy night, Ms. Gills. All in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Thank you very much.
Thank you.
Motion carried 5-0. Okay. Our next resolution, item 2 on our agenda, is to consider resolution number 1418, appropriating and disappropriating monies for the current expenses of the municipal corporation. There are 7 sections to this piece of legislation, but if someone could speak on the first 2, I believe Honorable Judge Sansbury is here.
Thank you, Mr. Chairman. Sections 1 and 2 simply cover the appropriation of funds in the professional services fund and disappropriating funds from the salaries fund in the amount of $11,000 to cover the contract hire of a part-time secretarial position down in the probation department. They only have 2 full-time clerical support staff down there. They're stretched pretty thin, and we do have the money that was in the budget for a full-time probation officer, but that position has been intentionally left vacant because one of our officers is going to be no longer covered by a grant that the OBI Corp receives. So we won't actually be spending money that we didn't already appropriate for the department.
Any questions from the committee?
I make a motion.
Motion by Mr. Bubb, second Mr. Costa. This is for the section 1, which was the actual appropriation. Or did you? We got to do them separately. So this is the first one. All in favor of? Oh, I'm sorry, Mr. Member.
Yeah. So my question is, if it's the position that is we're taking the funds from, basically, is because we're not going to receive grant funds. So how did we have funds? We had it was a partial, or we're just. Because if it was grant funds that we're not getting, it's really not money that we had budgeted.
Actually, Councilman, what it is when we put in our budget for the probation department, we budgeted for a certain number of probation officers.
Right.
We intentionally left 1 vacant because one of the officers down there is now currently funded completely through a grant. That grant runs through the first 3 quarters of this calendar year, but we expect that grant will be discontinued at that point. So those funds there for that vacant officer's position will not become necessary to pay her salary until the 4th quarter. So they have not been used to date.
Very good. Thanks.
Any further questions from the committee? Members of the audience?
Thank you.
Now, all those in favor of passing on section 1 to full council, signify by saying aye.
Aye.
Aye. Opposed, same sign. Section 1 is moved on to council. Is there a motion to move on to full council section 2? Motion by Mrs. Floyd. Second, Mr. Bubb. Any further questions? All those in favor signify by saying aye. Aye. Same sign. Motion carries. Thank you very much.
Thank you, Mr. Chairman.
The next section of this legislation is dealing with some retirements from our police department. Is someone from the administration list? Oh, Mr. Johnson, the auditor.
Section 3 will appropriate $29,500 for a retiring firefighter and a firefighter client. This money will come from the unappropriated balance of the compensated absences fund. That's money set aside just for this purpose. It doesn't impact the general fund.
Questions from the committee?
Motion.
Motion by Mrs. Floyd.
Second.
Second, Mr. Bug. Any questions? Comments? Committee or audience? All those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. That was for section 3. Now on to part 4.
Section 4 is the same thing as Section 3, except it's for a retiring police officer, and the appropriation will be $1,265 from the same source.
Motion by Mr. Going back and forth here.
I know.
Second.
Oh, okay. Mr. Cost wants to break the plan. All right. Moved by Mr. Bub, second by Mr. Cost. Any further questions from the committee? From the audience? All those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. Thank you very much, Mr. Johnson. Moving on to section 5 of this piece of legislation. Well, I guess it's 5, 6, and 7, though. Chief Sarver, thank you very much for coming and speaking on this.
Good afternoon. We're in a position to ask to have $60,000 moved from our salaries line account into equipment. When we formulated our 2014 budget, we funded 72 sworn positions, knowing that we were going to have some capital improvement items come up that wouldn't be funded by capital improvement. We also weren't sure if we would fill those positions until we got some idea of what kind of a salary increase the sworn officers might have to offset that. We're in some dire need of computer equipment, including servers. We have to update certain equipment. Some things are being mandated by the state. We have to upgrade from Windows XP to Windows 7 by April 1st, or we lose all of our ability to send information from our cars to the servers and so forth. So out of $118,000, we have a realistic need for technology-related equipment. In a police division, I know I'm not telling you anything that you don't know, but in a police division, people are important, vehicles are important, facilities are important, and so are technological things. We have to have computers to operate. In conversations with the service director, initially we were informed that we would get approximately $29,000 out of CI money that we could use to buy one police car this year. Our computer needs are far greater than what that one police car is. In working with the service director, we have agreed with Finance Committee's approval that if I can move $60,000 from salaries and not fill one of those positions this year, that he will make available $60,000 from capital improvement funds, which would total what we desperately need to fix. So my request to you is to allow us to move $60,000 from salaries into the line item that covers our technology equipment.
Questions of the committee? I was curious about the actual computer software that you're purchasing. Is there some type of warranty that goes along with what you're purchasing, or is there some type of service contract of what you're? Because when you buy $120,000 worth of stuff, I know from my experience in my employer, there's some type of yearly thing that goes along with that.
The information has been provided to us by our technology officer, Bob Carson, in conjunction with Alpha Links. We need to replace the core and storage server, update the operating virtualization, including labor alone, is $78,371. What kind of a service agreement comes with the server? He's not listed any added expense, so I have to assume that there's some warranty that will come with it. We need to replace certain computers, including laptop computers and desktop computers. We have to upgrade the operating system and the RAM in 45 police cars, including supervisors units, and then a production software upgrade, which is the Microsoft Office Pro, is $8,000, totaling $118,000. Knowing Bob Carson as well as I do, and he's a stickler to make sure that we get agreements, I'm sure this is all packaged into that. To give you a definitive answer that does this come with a warranty, I can only assume it does.
Okay. My next question would be is is there any type of replacement cycle that the equipment is on, like a 4-year replacement cycle usually, or is this just it was purchased by some type of brand or some money and it just...
We bought a lot of different, Barb's, she's still here. We bought so much stuff through grants. These are things that they're written, and Bob Carson has dug and dug and dug. There's nothing available that's going to fund this stuff. And we're at a stage now where April 1st, the state's going to say, you're cut off. We won't be able to transmit any of our reports that we do from our laptop computers. The servers themselves, any day now, could just shut down and stop, and we'll literally lose everything we've got. This equipment, and Pat here on his own time, that all of our servers that we currently have came with the facilities in 2005. So we're looking at 9 years worth of Band-Aids that we've put together to make this stuff work. And we've reached a stage now where the computer-related stuff, as sad as it is more important to us right now than people or cars.
And just to give a clarity to the comment you made, I'm in IT, that's my background, so I know that the Windows XP operating system end of life with Microsoft is in April, so that's why there's an urgency, so I can understand that. Appreciate that. Thank you. Any other questions from the committee? Audience? Ms. Best, please come to the podium.
Yeah, my question is, you said that it was going to be $78,000 in labor?
No.
Okay.
Ms. Best.
$48,000 for the server, $23,000 for the operating system update virtualization, $6,000 for the labor.
$6,000 for the labor. And whose labor is that?
Ms. Best, if you could just read off, say your questions, because I want to...
Well, I don't know what my question is until I hear the answer.
Well, this is what we want to do, is we want to have statements and questions directed to the chair, and then if he's able to answer your questions, then we will have him give time to answer those questions. But the dialogue that you want to have, you can have in the hallway if you like.
Yeah, we wouldn't want dialogue. That would just be horrible.
We want to have an orderly meeting, so I appreciate your cooperation.
As opposed to dialogue, which is...
Please state your question, ma'am.
So who gets the $6,000?
Is that your question? That's all your questions?
I don't know.
Well, then please sit down and I'll have the chief come up and answer.
Oh, this is ludicrous.
Thank you, ma'am. Chief can answer that.
It's my understanding work will be done by Alpha Link.
Thank you, sir.
I'm sorry, I didn't hear.
Alpha Link is how he responded.
Okay, I have a question.
Thank you very much. Is there any other comments from the committee?
Okay, so $6,000 goes to Alpha Link. That's correct?
Yes, that's what he stated.
Okay. So we don't have a contract with Alpha Link? I guess I don't understand why that labor wouldn't be inclusive in a contract.
It's my understanding from what he testified is that this is the contract they're entering into.
So the city doesn't have a contract with Alpha Link?
It sounds like for this particular project they don't, but if I'll allow the chief to come up. Please move.
Because I would like to know if Alpha Link has a contract with the city, is that not inclusive of the police department?
Okay.
And why wouldn't that $6,000 be inclusive of a contract with the city or the police department?
Okay, thank you for your question. Chief, can you answer that?
The service director may be better fitted to answer this question, but it's my belief that the city has an ongoing contract with Alpha Links for certain things that they do. Job specific, when we do this, it's a separate contract. I could be wrong, but that's my belief.
Okay. Thank you very much.
So we don't.
Does anyone from the administration want to clarify that?
He's correct.
Okay, thank you very much. All right, I'll entertain a motion to adopt Section 5 of 1418.
Motion.
Motion by Mr. Cost.
Second.
Second, Mr. Bug. Any other comments? Questions? All in favor, signify by saying aye.
Aye.
Aye. Motion carries 5-0. Let's move on to full council. And is there a motion for Section 6? Mrs. Floyd?
Second.
Second, Mr. Bug. Comments or questions? All in favor, signify by saying aye. Aye. Opposed, same sign. Motion carried 5-0. And for the final section, Section 7, please. Is there a motion? So eager earlier.
I'll make a motion.
Motion by Mrs. Floyd, thank you. Is there a second, please?
Second.
Second, Mr. Frost. All in favor, signify by... Oh, I'm sorry, Mr. Marty.
So this is the portion that's coming from capital improvements,
Yes.
correct?
Yes, sir. It's an operating transfer.
I'm sorry, any further questions? All in favor, signify by saying aye. Aye. Opposed, same sign, and motion carries. It moves on to full council. Okay, we are on our last piece on the agenda tonight is to consider resolution number 1422, appropriating and disappropriating monies for the current expenses of the municipal corporation. And Mr. Rhodes.
Thank you. Section 1 is for, we just want to reappropriate an insurance check that we received. These are for lights that go down along the bike path at Everett Park that have been vandalized and turned into insurance. It's a check. When we reappropriate it, we're going to fix the lights. We're going to get the lights on.
Thank you, Mr. Rhodes. Questions? Motion, Mrs. Floyd. Second, Mr. Bug. Questions from the committee? Questions from the audience? All in favor, signify by saying aye. Aye. Opposed, same sign. Motion carries. Section 2, please.
Thank you, Mr. Chair. We've got another check, an insurance check, in the amount of $4,510.60. We went ahead and we paid the repairs. These were repairs to Babe Ruth. We had some water lines that broke out there this winter, and then we also had some fence that had blown down. Those repairs have been made, and what we're doing is just reappropriating the insurance check that we've received.
Thank you, sir. Any questions from the committee? Motion, Mr. Marty. Second, Mr. Cost. Any further questions or comments? All in favor, signify by saying aye. Aye. Opposed, same sign. Motion carries.
Thank you.
Thank you very much, Mr. Rhodes. That concludes the agenda for the Finance Committee, and safety is next.
Okay, I would like to call this meeting of Newark City Council's Safety Committee to order. 5:50 p.m. Members present are Mrs. Floyd, Mr. Johnson, we have Mr. Koss sitting in for Mr. Guthrie, Mr. Rath, and myself. The first item on our agenda this evening is to consider ordinance number 14-04, an ordinance amending Chapter 618 of the Codified Ordinances of the City of Newark, Ohio, to require that all dogs be leashed when off the premises of the dog owner. Mr. Koss, would you like to give your comments on your proposal?
Yes, thank you, Mr. Chair. When we had the vicious dog legislation, in the midst of all that conversation, I was informed that Newark does not have a leash law. I think most of us, most citizens and most of us as a whole, assumed that we did. And when I found that out, I was rather concerned. What people were under a misunderstanding is we do have a rule that when a dog is in a city park, that the dog needs to be on a leash. But when the dog is out on a city street, that there is no such law in effect. What it says is the dog needs to be under reasonable control. Now, without a leash, I have to assume that only leaves voice command, I guess. So I'm proposing that we would want to have dogs on a leash when they're out on public property. When you're walking a dog down the sidewalk, I simply can't imagine taking a dog for a walk without having a dog on a leash for the safety of the animal, for the protection of property or anyone being harmed, or the dog running out in front of a car. Or I'm sure there are some dogs that are voice command and perfectly well trained that they would not do that. I know mine certainly is not. Mine is so slow though that it would never get hit by a car. It couldn't happen. But I think most dogs, if they see something, they are going to bolt, whether it's a dog or a cat or whatever it is. The dog's going to take off, and we're going to have a very upset owner. We're going to have a very upset car driver. We're going to have a very injured dog. So I'm trying to make this a concept of just responsible ownership and, from my point of view, common sense to protect the animal and everyone else involved. Thank you.
Thank you, Mr. Cost. Chief Sarver, would you like to give your comments on the proposal?
Thank you. When this committee met to talk about the vicious dog, I shared my comments about quite a few different things. One being that my wife and I are responsible dog owners. We have 2 standard poodles. We wouldn't dream of walking them down the street without having them on a leash. We shudder when we walk down the street and we see somewhat aggressive dogs that aren't on a lead because they're in a position where you can't always control what goes on in the dog's mind, and they may take off and may not. And oftentimes when an owner tells the dog to come back, they will. Sometimes they won't. I had a phone call conversation with Mr. Cost at the end of last week, and what I would like this committee to do is just spend some time before we move forward with this, and let's talk about a few things outside of this committee, if will, or we can do it in the committee. But a couple of things. For instance, it talks about the current wording that the law director's office has come up with says that whenever the dog's off of its property, that means if I take my dog across the street to my neighbor's property, it has to be on a leash, and that's just not accurate. I know what the intent was that when the dog is off your property and in a public area. But the way this is currently worded, I can't even take my dog across the street and let it run with my neighbor's dog unless it's on a leash. In the vicious dog ordinance, it addresses police canines, that if a police canine in the act of its job bites somebody, it shouldn't be deemed as dangerous. There's no wording here. So based on all this, my police officers couldn't even release a dog to track a suspect or to stop a suspect unless it's on a leash, because it gives no provisions here. The other thing I think that this committee needs to talk about and just have some dialogue about is under what conditions can that dog be off a leash? And I'll give you some examples. One of the things we push with the vicious dog ordinance is when people would get their dogs trained through the Good Citizen Award through the American Kennel Club. So we did this with our 2 dogs. If you're going to teach them how to sit, you're going to teach them how to heel, you're going to teach them how to stay, because that's all part of that Good Citizen requirement, that the dog has to stay on a sit or a down for X amount of seconds, minutes, before it can get up. You'll see homeowners walking down the street in quiet neighborhoods. I'm not talking about 21st Street or Main Street, but they may be practicing with their dogs. They're there, they're reasonable, they're somewhat under control, that if cars come, they're going to get hold of the dog. But there are those situations where a person could be working with their dog to better training. And by the letter of the law, if one of my officers drives by, we're going to give you a ticket. Now, we know in reality that's not going to happen. We have a magical saying in police work called police discretion. We don't tell our officers that every single time somebody's a mile over the speed limit, you will write a ticket. It depends on the circumstances. Somebody clips a red light, they weren't flying to get through it, they've got a good driving record, they have insurance, they've never had a ticket before, police discretion comes into play. Or I believe, as Mr. Cost said, common sense. So we're not going to give somebody a ticket every time they're walking down the street and their dog's not on a lead. If that dog's 30 feet in front of them and they have no control over that dog, and somebody calls to complain, I'm going to expect my officers to do their job. So I agree with you 100% that we need to have a leash law in effect. I think we just need to have some conversation on exactly what that's going to be before we move forward.
Thank you. Yes.
Can I ask the chief a question?
Yes.
Chief, we have a current law in place now that says the dog needs to be under reasonable control. If I feel that I can reasonably control my dog without a leash, then that's reasonable control. If I feel that I can't control my dog without a leash, then to have reasonable control of that dog, I need to have a leash. There's going to be dogs who are going to get out and run around and bite people, and we're going to ticket them or cite them. And obviously those dogs weren't not under reasonable control. Do you see the leash law being a little redundant as to what we currently have?
That's a piece, Mr. Rath, where I think we need to have some conversation. What is reasonable control? If the dog is right next to you and it's not on a lead, but you're in a position to grab the collar, if you saw a kid coming down the street on a bike, is that reasonable control? I would offer to you that there are some people that walk their dogs on a lead, that if that dog bolts to chase another dog or squirrel or a child, they're not going to restrain that dog anyway. Our dog walking down the street has pulled out of our hands once or twice. It happens. So it is really going to be hard to define what is reasonable control. Walking down a city street, I would suggest that it says that the codified ordinance says that the dog must be under a leash. If you're working with the dog and you're on a relatively nice neighborhood, that's where police, when I say nice neighborhood, not much traffic. That's when we have to take into consideration exactly, does that dog truly have to be on a leash or not? And I don't know how you word that. And that's why I'm asking the committee, just give us some time to play with this a little bit, massage a little bit. And I agree that there needs to be something in place that they're going to put dogs on a leash in the proper times.
Thank you.
And also, in our conversation, and I want to express this publicly too, first of all, I appreciate how much help you've been. The whole concept, I'm certainly not looking for police officers to be out hunting for people walking dogs without a leash. And I think it's very reasonable to say this would be a complaint-driven type of situation. I'm just trying to avoid as many injuries to people, vehicles, animals as we possibly can. And to my outlook on this, it's a step in the right direction. I do agree that we want to emphasize when they're on public property. I guess if you're going to walk your dog across the street to your neighbors, I would assume it would be on a leash to get to the neighbors. But once it gets there, I'm not expecting anyone to tell anyone what to do on private property. I don't think that's reasonable. But crossing the street,
The current legislation says when it's on the owner's property.
So I think the emphasis needs to be more on when the dog's out in public, like it is in a park, like it would be walking down a sidewalk.
And while you're looking at this, unless I'm completely wrong, I don't think the city of Newark has a pooper scooper ordinance as well. And most responsible dog owners will carry a small garbage bag from Kroger's or places. You see tons of people that just let their dog do their business and ignore it. So you might want to package this all at the same time and revisit the whole area here.
Could I ask one quickly?
Yes.
Would you advise us to maybe table this and take the time to look at some of these issues? I think I'd like to do that if that's an acceptable thing to do.
Yeah, Mr. Cost, I would suggest that if we're going to be amending a bunch of things with regard to this legislation, I think it might be best to table it so that we can have some discussions with Chief Sarver and play with the wording of that a little bit better.
And do we set a date for that for what we table, sir?
Well, yeah, with tabling, you don't set a date.
Okay.
You can, but it's not necessary.
Okay. All right. Thank you.
Mr. Chairman?
Yes.
It seems to me that there are a number of things we need to change, so I think maybe if we just table it until we feel it's time and work with the law director's office to get some of these things down that we need, because I mean, I know I have company who comes to my house and they bring their dog with them, and the dog is out in my yard. That's obviously not the dog's yard, and so all of that, everything you've said makes sense to me. So, and this is basically the original ordinance that we had on the books with the capital letters in section 1 is the addition to it. So, this is what we had, because I called the law director today to ask him about the part about cats, and I thought, what's that have to do with the leash law? But that was already in our ordinance, so, thank you.
And I agree that we need to revisit it all the way through, although I'm very much for the leash law.
Do we have any other questions for the chief from the committee?
I'll make a motion that we table it.
Second.
All those in favor, please signify by saying aye.
Aye. Thank you, Chief.
Thank you.
Thank you very much.
Thank you very much for coming.
All opposed, same sign. Motion carries 5-0. Did we have any discussion from other council members? Or,
Yeah, once we table it, we'll talk about it. We're done.
okay, that concludes our agenda for this evening. Thank you. Service is next.
Okay, before we get started with the Service Committee, I have to open a public hearing. It's a public hearing to take action upon resolution number 14-20. Said resolution approves the renewal application for placement of farmland in an agricultural district for the property located on Riggs Road, Newark, Ohio 43055, and declaring an emergency. Is there anyone to address resolution 14-20? Is there anyone to address resolution 14-20? Is there anyone to address resolution 14-20? I will close the public hearing and forward resolution 14-20 to the Service Committee tonight. Thank you. Now it's time to open the Service Committee. Bring the Service Committee meeting to order. Our members tonight are Mr. Blake, Mr. Rath, Mr. Roletta, Mr. Bubb, and myself. And here we go. Mr. Reed, would you, at the discretion of the chair, would you like to go first so you don't have the joy of sitting through everything else that we're going to do this evening?
I would be willing to sacrifice.
That's very open-minded of you. Thank you so much. Mr. Reed.
All right, I'm here tonight to give one of their 2 annual reports, and this is kind of, I guess, the 2013 wrap-up, 2014 look ahead. The annual report that is going around, we've got some out here. If anyone wants some in the audience or some extras, should have all got that mailed to your house. If not, let us know. But probably a big thing for 2013 for us was that we passed our national accreditation. We got notified in October, November that we were one of the first 22 in the country, second in Ohio, and as of right now, we're still one of 22 in the country and the second in Ohio. So presumably other places will be passing that, but to get through on the first round of that accreditation, the site visit, and everything that went with it was quite an accomplishment. And that'll continue. Then we have to give annual reports, anything where we hadn't met kind of optimal on the evaluation, then we have to report how we're doing the quality improvement and working to continue to get better. Even though we do have that stamp of approval, it's not a static thing, that you're always trying to improve. One of the things we kicked off last year also was our tobacco use reduction initiative. We set a big goal of reducing the smoking rate in Licking County by 50% over the next 10 years. And that group's been meeting. They're meeting again next week to hopefully wrap up work on the strategic plan, how to try to reduce especially smoking rates, access to tobacco for youth, increase cessation, access to cessation for people who are smokers. Just trying to turn that statistic on both ends, stop feeding the smokers into the system by stopping those kids smoking when they're in high school or by the time they get out of high school and becoming lifetime smokers, and then helping what we know where the majority of adult smokers who would like to quit but have been unsuccessful in trying to improve that success rate. One of the things we just did for this last month is our food service, our restaurant, grocery stores, those kind of places. Those inspections are now available on our website. The advocate for years has been requesting that we send inspections to them, and they put them up on theirs, but now our inspectors are using electronic computers and tablets to do the inspection, and it pretty much immediately that same day does an upload into that database so people can go online, look at that. As we start doing our swimming pools, those swimming pool inspections are also available in there, and more of our things that we issue permits for will be added to that as we continue along. So we're one of the first places in the state to have adopted this new software that now also lets us communicate to the state, so we don't have to print things off, email them, or send them out quarterly reports and things. It's all, they have access to the database and they can pull reports. So it should be a time saver and an improvement there. It also lets us email the report to the owner of the facility, so we don't just have to maybe leave one with the manager, and who knows whether, if it's not a good inspection, maybe whoever whose name's on the license, the owner may not ever see that inspection. So I think there's a lot of improvements there. We also early this year had a bed bug summit. We had over 20 people in attendance to that. We had a pest control operator. We had somebody from Department of Agriculture. Legal aid there to talk, because most of our complaints are coming in on rental properties. And just kind of provide public education on what bed bugs are, how they can help deal with them, what resources are out there. So that's something we had been working on, and we're glad to get that done. We've also been out to Washington Square and done bed bug presentations out there for their employees and their residents. One of our downsides here recently, one of our long-term Board of Health members, Rod Ellis, is retiring from the board after 15 plus years. So he's past president, we'll definitely miss him. The District Advisory Council, which is who appoints members to the board other than when it comes from the city, through the city councils. They meet tomorrow, so they'll be appointing a replacement for that position. So we keep our 11-member board at full staff. We also have Ron Dirks, who is our mosquito control summer technician, who worked for Newark City Health Department before he became part of our staff, and I'm not sure for how many years he did that job, and he's the one who got shot at a few years ago while doing mosquito spraying, and he's now retired, so we're going to have to do some training and bring people up to speed on that. So if you have any suggestions on things that you would like us to do better, or have any problems throughout the year, be sure to let Chad Brown, who's our environmental health director, know, and then he can address that, making changes to the program or training the staff that we have to bring in. I've also brought Mary Beth Hagstead, that's our nursing director, so immunizations, flu, all those kinds of things, disease outbreaks, our early childhood program she's in charge of, and Barbara Lanthorn, who's our administrative services director, so all the personnel and money, all those kinds of things she takes care of. So certainly there's only so much I can do, and without those staff and the actual field workers, we couldn't reach the point of accomplishment that we have, and certainly without the support from financially and from the community and from our funders and all the grants that we receive, we couldn't do what we do. If we look at our finances, over a third of our money comes from grants, about a third comes from fees, and roughly a third comes from all the cities and townships and villages tax base. So I think we're in a very good position as far as having that financial diversity and being able to, where a lot of places have really struggled through the economic downturn, because they relied so heavily on building permits or whatever. We've been diverse enough, we've been able to kind of ride out the storm and hopefully coming out the other side. So, any questions?
Mr. Chair. Joe, thanks for coming tonight. I appreciate hearing the information you're giving us. I do have a question about the nursing services that you provide. And I was curious, are you noticing any trends that are occurring in the community? You have some statistics in here over the last 2 years, but are you noticing, say, like with STD testing or HIV testing, or are you the numbers are slightly dropped a little bit, it looks like, for 2013, but are you seeing over the number of years any type of trends that might be significant or anything?
Well, what we've seen for the past few years is our chlamydia, one of our STDs, has been really high. We've put together a group to try to work on a strategy, from Family Health Services, who does family planning, from our agency, from Lincoln Memorial, different people that are involved trying to figure out how can we kind of turn that around. Because we're only, we run an STD clinic 1 day a week. There's only a limited number we identify. A lot of them are identified at their doctor's office, especially for pregnancy. They'll get a screening when they find out they're pregnant and then find out that they had an STD. So we've tried to work on that. We tried to improve the partner notification piece, where you don't get an STD all by yourself. And trying to get that, if you're positive, we'd like to be able to bring your partner in or your partners in and get tested. And that's probably where we've had the least success. People often don't want us calling their partners, and they're not always willing to share that information with them. So we're trying to work. We've done some screenings now at OSU Newark, often some on campus there, to try to just randomly catch people that aren't coming in because they have a symptom, especially for chlamydia a lot, and definitely for men with chlamydia, and even for women a lot of times they don't know they have a symptom. And with chlamydia especially, they can result in problems getting pregnant later for those women if it goes long-term undiagnosed. So that's probably one of the big things we're seeing. We've also have an access to care committee that has a lot of different agencies represented, and talking to that group about the expansion of Medicaid, the Affordable Care Act, how all that plays into what we have done for free services in the past, and trying to get people enrolled, and then also some problems with the amount of Medicaid spend down that the state requires. So unlike when a child gets on Medicaid, they come in and they get services, they don't pay anything extra for it. With the expanded low-income adult type of Medicaid, they're expected to spend a fair amount out of pocket before that Medicaid even kicks in, and unfortunately that's the population that doesn't have money in their pocket, so they're still facing an issue. If they have a catastrophic illness, the hospital is going to get paid for most of it because it's going to get past that big deductible. But for routine care, which is what we really want them to be having, they're still running into some barriers there. So we're just early in that whole process of trying to work out the bugs and make that system work.
Mr. Chair, can I have a follow-up? Joe, just a specific question about HIV and AIDS. I know Lisa Murphy at the AIDS Resource Center, which is in my ward on Union Street. I'm trying to make rounds to all the different groups that are in my ward, but I had a conversation with her, and I was just wondering, have you guys ever had any relationship with the AIDS Resource Center at all, or because I know she does some HIV testing as well, and she seems to have, it's prevalent in the community. And I was just wondering, as far as your partner organizations or anything, if there's ever been consideration.
I know we worked with Family Health Services, who has a grant from the Ohio Department of Health to do STDs and including HIV testing and treatment. We also do, the state provides free testing materials, and right now we don't charge if someone comes in and gets tested. They're kind of working to have us enact a sliding fee scale, so there'll be potentially charges if people have any money. So there's access to the testing isn't really a problem. I think a lot of people, it's it doesn't come to mind. Either they don't want to know or they don't think they're at risk.
Certainly, statistically, Licking County doesn't have anything exceptional as far as HIV statistics, and a lot of that I think is the data is reported up to the state. Sometimes it takes a while for us to even get those numbers back because we do have other people that are testing. It all filters into the state system, and it's unlike a lot of other diseases. We don't automatically find out. We've got 3 people with HIV in our community because it is treated more confidentially than it would be if it was a foodborne outbreak or something. So there is some disconnect there.
Any other questions, committee? Any questions out of the audience? Ms. Betts?
I can't talk to you directly anymore. I'm curious what the software is that the health department uses that makes their inspections so much better. Also, does the health department have satellite clinics, like maybe one downtown or closer to target areas? And also, when somebody comes in with an STD, a sexually transmitted disease, do you counsel them on birth control? Do you offer birth control?
Thank you.
Okay, try to answer those. Let's see, the software is called HealthSpace. The state put out to bid a year or 2 ago for a vendor nationally to try to get more of the stuff we're kind of the state's agent in, like issuing food licenses and things. So they use that. The other company that we've used in the past worked pretty well for us for the last 10, 15 years, but it's a little outdated and didn't have that kind of web-based access. You had to go out, do inspections, come back in, do an upload, and then it was still just in your server. So this is kind of bringing you up to the more net-based software. And fortunately, at this point, it doesn't cost us anything extra out of our pocket because the state saw some benefit to it. So that's one issue. As far as the clinic locations, we have satellites for immunization clinics, as well as our WIC clinics we do in Johnstown once a month, Buckeye Lake once a month, Pascagoula's immunizations once a month, twice a month for WIC. We don't currently have any satellites downtown, although we do send one of our nurse practitioner to the community health clinic, which is just downtown here, to help out there, where they see uninsured adults at that clinic as well. We used to have a WIC satellite in town, but it got hard to keep our rent up sometimes because we were trying to get it for free from the church, and usually we wear out our welcome eventually. It is one of our struggles. It's one of our struggles with the transportation system. That there's not a reliable, not easy transportation to get out to our office. Especially for people that aren't planning ahead far enough to taking care of that. But I think it's better, somewhat better than the taxi service that we used to have, but still being on that kind of outskirts of town, we're a little bit out of the loop there. And even though the bike trail terminates fairly close to our office, it doesn't go all the way out there. That's another area we'd like to see addressed at some point. Then at least people could go from Walmart to our building or whatever on foot. So that would open up that transportation access a little bit from the north end of town.
Birth control?
Birth control, we provide, we do talk to them about birth control. We do provide condoms for free. We don't prescribe birth control. They can get that through that Family Health Services clinic. They get the grant money that pays for all that kind of stuff. So we've talked about potentially getting into that, but as long as they're able to provide that at their facility and get it paid for under a grant, we so far haven't felt that we wanted to compete with them and do it for free as well. But if that would become an issue where they weren't able to do it, then we have talked about stepping in and filling that void.
Thank you, Joe. Thank you very much. Okay. Resolution, next is Resolution 14-19. A resolution authorizing and directing the Director of Public Service of the City of Newark, Ohio, to negotiate and enter into contract to provide sanitary sewer service to the village of St. Louisville within the North Forks segmental sewer district. Mr. Lewis.
It's just an authorization for us to enter into a contract with the village of St. Louisville. St. Louisville is currently installing a sanitary sewer collection system. In 1977, the city accepted a grant for installing a North Fork interceptor. That North Fork interceptor runs up to the, if you're familiar with that area, Prescott Estates area. That was also designed, and this was federal grant money that was used to install that to service the area which is known as the North Fork Segmental Sewer District area, which is also known as Licking County Sewer District Number 2. And the city of Newark, the village of St. Louisville, and the Licking County at that time entered into agreements that they would, the city would service that area, and if the village of St. Louisville ever put in a centralized sewer system, we would accept their waste and treat their waste. So we're in the process of putting together an agreement with them, and that agreement basically is how we are going to handle discharges into the sewer, who's responsible for what, that kind of thing. And so we're almost have that resolution completed, or that agreement completed. There's a couple of final issues we've got to deal with. I think we're going to keep Caroline in the loop on that. We have some other attorneys working on that. We work on water agreements all the time. But that's almost, we got the agreement almost ready to go. We just need some authorization to enter into that agreement. So.
Mr. Chairman, questions? Okay. Just to clarify, when I was reading through this, so I mean, there's really two big reasons for us to go into. I mean, one is sort of like we're required, but the two reasons is, they're north of us, so if we don't take care of it, it's going to come into our water system. And then also there's a possibility to gain revenue off of this too. Is that correct?
We'll obviously be charging them for those services, but this is also in the watershed of our drinking water system. Originally, Prescott Estates had their own treatment facility at that development up there. It failed back in the late 70s. That was one of the impetus for the North Fork interceptor that was installed. And that's when that treatment plant went out and we took their waste. So there is some advantages, major advantages, to protect our water supply in that area. And which is a good thing to get all those septic tanks out of St. Louisville and get a centralized collection system.
Motion.
Second.
Motion by Mr. Rath. Second by Mr. Blake. Are there any other questions from the committee? Any questions from the audience? All in favor? Aye. All opposed? Move this on, council.
Thank you.
Thank you. We have ordinance number 14-03, an ordinance annexing certain territory generally described as being 0.275 acres, more or less, Lot 26 in Van Tassel, Mount Vernon Road allotment, located in Newark Township, to the city of Newark, Ohio. Is there someone to present this information? Mr. Rhodes?
This is a piece of property wants to annex into the city. I believe from here it goes to the Planning Commission, which we will take a look at it and render an opinion on.
Motion. Second.
Motion. Second by Mr. Rath. Any questions from council? Committee members? Any questions from the audience? All in favor? Aye. All opposed? Thank you. Move forward. 5-0. Thank you. Resolution number 14-20, resolution approving renewal application for placement of farmland in an agricultural district and declaring an emergency. Mr. Rhodes?
It's just what it is. It's a renewal for an agriculture district.
Motion. Second.
Motion by Mr. Second by Mr. Blaine. Any questions from the members of the committee? Any questions from the audience? All in favor?
Aye.
All opposed? Moves forward to council 5-0. Thank you very much. Thank you, Mr. Rhodes.
Thank you.
Resolution 14-21, a resolution authorizing and directing the Director of Public Service to accept bids and sell certain surplus personal property now owned by the City of Newark, Ohio, and declaring that such property is no longer needed for any municipal purpose. Mr. Rhodes.
What we're doing here is we're going to have an auction out at the service complex for cars that we've taken into the impound lot. And we're just asking permission to do so.
Motion.
Second. I do have one question.
Go ahead.
Where in the world did we come up with 67 automobiles?
Off the side of roads, abandoned vehicles, it's amazing. As a matter of fact, we're going to have 2 auctions this year. We'll have another one in September. This list could have been 100 if we could have got them processed. And then we have miscellaneous four-wheelers, motorcycles, and different things like that. Probably have 150 bicycles that have been abandoned that will be sold out there that day too.
How many bicycles?
Probably 150. I mean, they got them stuffed everywhere.
Mr. Chair,
Yes.
if we don't, what happens to this stuff if it isn't auctioned off?
Well, it just sits there, and it continues to accrue fees, and it goes unclaimed, and it just rusts and weeds grow up around it.
So if we have the auction and say like all these 150 bikes don't get auctioned off, then what could we give them to an organization or something?
I'd have to check with the law director to make sure we're allowed to give them away, but they sell these bikes for $1 or $2,
So you expect
$5.
everything to go, so, okay.
Yeah, the last 3 auctions I've done, we've sold all the bikes, and there are people there that buy them, buy 10, 12 bikes and take them, and then they do give them to organizations like that. And if you have an organization in need, you can get a bike for $1 or $5, something like that.
Any other questions from the committee? Any questions from the audience? All in favor?
Aye.
All opposed? Goes to council 5-0. Thank you, Mr. Rhodes. Ordinance 14-05. An ordinance changing the zoning classification of certain real property generally described as 1567 West Main Street, City of Newark, Licking County, Ohio, from that of General Office District to Limited Intensity Business District. And Mr. Rhodes?
Again, this is another one that you're forward to Planning Commission. We'll take a look at it and we'll render an motion.
Second. Good question.
Yes, sir.
What's the main difference between general office district and low intensity business district?
Jeff, I'd have to get back with you on that. I don't know how to remember that.
Can I ask a follow-up question?
Sure.
Is this the building where Aaronsburg is?
I don't know.
Yes, I'll answer that one.
Yeah, because that's looked at.
It's the other half of the Aaron'sburg building.
Yeah, it's something I haven't looked at. And I don't know who's trying to go in there.
Jewelry store. It says a designer jeweler.
Yeah. And again, it's not something we've looked at yet. We'll want to get some planning commission.
Perhaps they'd be interested in pitching in money for a traffic light at that intersection.
The jewelry store?
Yes, at the intersection of Terrace and West Main. Just saying.
Like a sledgehammer.
Nothing else, I'm persistent.
Put it in and appropriate it somehow.
Service director's salary.
You can do that.
Any other reasonable questions from the committee? Any reasonable questions from the audience? All in favor? Aye. All opposed? That will move forward to council with the traffic lights so noted.
Appreciate that.
And that is, I'll do for a 6-month meeting up there with them.
That is all I have. We have a motion to close the service committee.
Thank you.